Hi, my name is Jeannie Lauren Dowden for Conduit News. Today we are joined with Senator Dan Sullivan. He is joining us from the Arkansas State Capitol today. Thank you, Senator. How are you doing?
Thank you. Glad to be here. Fine, thank you.
So today we have several things unfolding regarding, we have the public health emergency order, mask mandates, several issues happening. Just go ahead and dive in. What happened today at the Capitol?
Sure. Today the governor had a proclamation. I've got it right here. And the way the law reads, the governor makes a proclamation and the legislature has an opportunity to offer other proclamations if we so choose. So, and if we don't, then the governor's proclamation stands. So the legislature doesn't vote up or down on the proclamation. And in fact, the proclamation has some good information in it. I don't know that the governor can't do it anyway. He doesn't need a proclamation to do it. But just to be clear, the governor's proclamation says that he's going to work with the Arkansas Division of Emergency Management to help our healthcare facilities and hospitals deal with the staffing issue. Yesterday we heard testimony from the hospitals that said beds are not the problem. They have plenty of beds statewide. The problem is staffing, that we don't have the nurses particularly to staff all of those beds. And in a sense, we have created our own emergency. We have several hospitals, particularly up there in Northwest Arkansas where you are, that are having vaccine mandates. And many of the nurses, number of nurses are leaving the profession because they choose not to get the mandate. And as such, the number of nurses just is down. So this proclamation that we did today is there to address that and just work particularly with the staffing problems that we're having at our hospitals. That's a good thing.
Well, before we talk more about this declaration, are you seeing any bill or activity to help defend these employees who are seeing these mandated vaccines happening with their employers?
Sure, and good point. And also as a part of this, we may or may not have a special session as we're taping this. I think the governor has a speech later today, presentation with the media. And he may or may not call a special session. If he does call a special session, it will be most likely to deal with the insurance that the court struck down the other day. You can come back to that later if you want, which is a good thing. And then there will likely be the mask mandate for schools on that call also. But the legislature also, if we have a special session, would like to bring up some legislation. And part of the legislation that we will be proposing will be some protection for employees who have been chosen not to be vaccinated. Our nurses are a great example. During the previous pandemic, they worked without a protection, without a vaccine. And back then we called them heroes. And now our hospitals are trying to fire them. So you go from hero to unemployed. Well, the legislation that we would propose would probably do several things, and not ready right now to go into a lot of detail. But the most important thing it would do would be if a private business mandates a vaccine, then that private business assumes the responsibility and liability for any negative or adverse reactions that a person has since they took the vaccine as a condition of employment. That would require a change in the law, but I think you'll see legislation proposed in the special session to address that. Now, if the legislature brings up legislation, it takes a 2/3 vote for us to consider that. So it's a pretty high level, but I would hope the governor might add that to one of the items on his call, but we'll see. But again, specifically to address your question, what protections are out there? We've got to do something because people are losing their jobs. It's a bigger deal than the masks, but it's kind of hidden over here on the side and you don't see the media covering it.
Yeah, you're right. It's almost as if it's just kind of a given, right? That just, oh, what's the big deal? Let's mandate these vaccinations and just carry on with your life. When actually, you know, it is that is a huge ask of someone to just mandate these vaccinations.
Yeah, a vaccination that is not approved by the FDA.
Right.
You know, it's on a temporary basis. It hasn't been studied. And, you know, there are a lot of particularly young women of childbearing age that are just concerned. And I think
Right.
to be disrespectful of that concern or dismissive of their concern and say, well, just go ahead, is not right. And again, the least protection that we can offer is to make a company that requires a vaccine as a term condition of employment. They ought to be responsible and accountable for that.
Right. Just provide that accountability. Absolutely. Let's go back to the proclamation that we were talking about that happened today. What does that look like for the state of Arkansas? And so we talked about this will, at the minimum, last for 60 days. We know that when this happened originally last year, this, you know, it was able to be extended several times. Is that possible again?
Well, if one respects the Constitution, no. However, that's a question in and of itself. But that's why I filed another resolution to only make it last 30 days, but we didn't have the vote, so we had to lay that aside. But again, this proclamation is very specific to what is allowed. And all it allows is the Department of Health to find regulations and statutes that are related to licensure of healthcare professionals. That's all they can do.
Okay.
So if the governor would decide that he wants to allow or require masks in restaurants, or require restaurants or other businesses to do certain things, he would have to have another proclamation. And that second proclamation would come back before the entire legislature, just like this one did. So I think the Hammer-Gazaway bill did a lot in kind of reining in what powers the governor has. This one is very specific. Again, I think the governor could have done what he is doing in this proclamation, could have done it just as a regular course of business. He chose to do it by proclamation. But again, it's not dealing with some of the things we went through in the last pandemic that were so impactful for businesses. If he did that, we'd have to come back.
So then that may offer a bit of reassurance for some Arkansans then.
Yes.
So just to speculate on what you think may be called or may happen with the special session, what do you anticipate?
Yeah, I think the two things that I'm hearing will be on the call. One will be the insurance bill to end unemployment. I think that's a good thing. I think that'll have a lot of support. The other issue will be masks in schools for kids 12 and under. If that happens, there'll have to be a sponsor in the House and a sponsor in the Senate to run those bills. I don't know who those sponsors will be in either part of the legislature. We'll have to see. There's a chance they could go through the Education Committee. Rightly, they should go through Public Health. That's where that mask bill, Senator Garner's bill, came through Public Health. If we do it rightly, that's where it will go. If people are going to play games, it'll go to a different committee.
Well, why do you think that they would run it through the Education Committee?
Well, I think the public, whether it's education or other, I mean, it's not unusual for people to try to run a bill through a committee where it has the best chance to pass. Right. So, that's how it works down here.
Right. So, so tomorrow possibly they could call special session, and you mentioned we were talking about the things that the governor may list. He doesn't have to give necessarily the specifics of the bills or what would be included. Talk to us a little bit about that.
Sure. So the part of the process is on the call, the governor will list the items that he has on there. He doesn't necessarily have to produce the bill. However, in the insurance case of the insurance bill, there is a senator who has written that bill, is going to sponsor it, and I think it will be public probably within a couple of hours it'll be out there on the website, published as a bill, and people will be able to see that. If there, as far as a mask bill for 12 and under, if there's no sponsor, then there's nobody to post the bill. You know, the governor can't put a bill on the call without a sponsor, I don't think. We'll see if that happens. But right now, I just haven't seen the bill that would deal with masks for kids from 12 and under. And then, of course, when the session comes, we're going to have, I have seen drafts of legislation that will have a House member or a senator who's going to propose educational choice legislation, probably similar to what Representative Lowry ran last session on tax credits. I think you'll see a bill come up on that. Again, that takes a 2/3 vote of each part of the legislature to bring that to the floor. So obviously, if it comes to the floor, it's got a strong chance of passing. We'll probably see legislation on critical race theory come up to stop the teaching of critical race theory. We passed a watered down version of that, but not a real strong version. So I think you'll see legislators bringing up those two issues in a special session. And I hope we can get the support from both chambers to pass those kind of bills.
I think this could be really encouraging for a lot of our Kansans. If you see school choice as well as CRT legislation coming through, and then like we talked about, you know, this would be under an emergency order, which means that it would go into effect immediately. For a lot of parents, that means that they could then, this would go into effect for the 2021-2022 school year. A lot of parents would be incredibly encouraged by this if it passed.
Yeah, let me just back up. This wouldn't come up under an emergency proclamation. This would be regular legislation. And if it has an emergency order, which you mentioned, if it passes with an emergency order, it goes into effect immediately. And I think, you know, the governor has talked about local control. That's why he wants the mask, to give the local control. There is no greater local control than individual choice. That's the local control that our founders had in mind, to give people a chance to do that. And that's exactly what educational choice is. It's letting them keep their money for their child. And if you want to have local control, then let's have local control through educational choice. What a great idea.
I think so too. And, you know, the governor has said many times, you know, the most conservative thing to do is to pass that down to the local school boards. Well, the local school boards answer to a number of, you know, organizations and unions, whether it's, you know, the AEA or the Superintendent's Association or teachers unions, whoever it may be. That has nothing to do with the parents who has, you know, their child at that school district. And so, you know, we could not disagree more with the governor's stance on that. The most conservative thing to do is to give that choice to the parents. The parents know best regarding their child's health care. And so, you know, we are very excited about, you know, giving that choice to the parents. And we hope that, like you, that these senators and legislators just hold fast on all of these.
You know, the governor actually supported Representative Lowry's bill. So he was behind the school choice bill originally. So hopefully he'll be behind it now. And we can all get on this and do it.
Yeah, well, but I'm also talking about, he said the most conservative thing to do is to give the school boards the choice regarding the mask mandate. And I'm like, no.
Yeah. There's one at a higher level, right?
Right.
Yeah.
Yeah. Well, is there anything else that you'd like to add, or just, you know, tell us about this upcoming week that maybe we need to know?
Well, you know, just stay engaged. I've gotten more emails on this issue than any I've gotten, and this is my 7th year in the legislature. And you know, I've gotten hundreds every day, by far opposing the mask mandate in school, probably 15 to 1, who do not want their local school or the legislature to impose masks on people. So continue to contact your legislators. I think the hidden issue out there right now is the vaccine mandates that private businesses are doing, and I really struggle with mandating that what private businesses do, but we are getting past that point. that people need some protection for their jobs. And exactly what that looks like, I'm not sure. But if businesses are going to require that, then they need to be the ones accountable for what they require at a minimum. So people stay involved, stay engaged, contact your folks and your legislators and let them know how you feel.
Thank you so much, Senator.
Thank you. My pleasure.
All right, we'll talk to you soon.
Okay, bye. Thank you.
Bye-bye. Thanks so much for watching. Be sure to like, follow, share, and subscribe. For Conduit News, I'm Jenny Lauren Dowden. We'll see you next time.